In long-term care facilities all across the country, there's this incredible workforce that we count on to take care of our parents, our grandparents, our most vulnerable people. But the system that's supposed to be supporting them, well, it's kind of breaking down. Today, we're going to dive into this crisis in care and get to know the people at the very heart of it.
And that really brings us to the central question, doesn't it? They spend their days caring for our loved ones, but who is caring for them? I mean, these are the folks providing constant, round-the-clock support, but so often, they're the ones struggling, caught in a system that's just squeezing them from every single direction.
And this isn't just one simple thing we can point to and fix. As our source material puts it, it's a complex bundle of persistent problems. Think about that phrase, complex bundle. It means all these challenges are tangled up together, creating this downward spiral that ends up affecting everyone, from the caregivers all the way to the residents they're there to serve.
So first, let's pull back the curtain on who we're even talking about. This is an often invisible workforce. So who are they, and what does their day-to-day reality actually look like?
We're talking about your certified nursing assistants, your CNAs, your LPNs, aides, therapy techs, all the support staff. And their job is, well, it's incredibly demanding. It's not just the heavy physical work, lifting and turning residents. It's also the enormous emotional weight of watching residents decline and dealing with death, sometimes on a regular basis. That takes a huge toll.
To really get our heads around this crisis, it helps to break it down. You can almost see it as a vicious cycle, with three main parts that just keep feeding into each other, making the entire situation worse and worse. So let's unpack each one.
All right, part one is all about staffing and burnout. It starts with this. Many facilities are just severely short-handed. That means the staff who are there have to carry a much heavier workload. And what does that lead to? Burnout. And when people get burnt out, they quit, which of course just makes the staffing shortage even worse. It's a classic, brutal feedback loop. And all of this is happening while demand for these workers is only going up.
Okay, part two, compensation and culture. For how incredibly difficult and stressful this work is, the wages are often, let's be honest, frustratingly low. Then you add in weak benefits, maybe no clear way to move up, and a workplace culture where people just feel undervalued, like nobody's listening. So you see, it's not just about the paycheck, it's about feeling respected and having a future.
And the final piece of the puzzle, these massive systemic pressures. You have to remember, these facilities are in a tight spot financially. They're under intense regulatory scrutiny, and they're getting squeezed on reimbursements from programs like Medicare and Medicaid. That means there's just not much money left over to raise wages, or invest in training, or hire more people, all while the residents are coming in with more and more complex health needs. So what happens when you throw staffing shortages, low pay, and all this systemic pressure into a pot and stir? Well, you get a massive ripple effect. And it doesn't just hurt the workers, it harms the entire operation and, most critically, the residents themselves.
If you had to pick one thing, one key driver that just makes everything else a million times worse, it's this: extremely high turnover. Think about it. When your experienced, skilled staff are constantly walking out the door and you're always trying to train new people, it creates this deep instability that just echoes through every single part of the facility.
And this chart here really connects all the dots for us. Just look at it. High turnover, right? For the business, that means spending way more on training and expensive temp staff. But for the residents, it can mean poorer health outcomes. Now look at staff burnout. That can lead to more mistakes and a higher risk of accidents. And low wages. Well, that doesn't just make it hard to hire people. It can literally mean less one-on-one time for each resident. It's a crystal clear link between workforce problems and the quality of care.
Okay, so we've laid out this deeply, deeply human crisis. But now we're going to pivot and look at this from a completely different angle. Let's check out a proposed solution that reframes this whole thing, not as a human problem, but as a business performance problem that you can solve with a system.
Now, this approach tries really hard to set itself apart from your typical corporate wellness program. It's not about perks like free yoga or fruit in the break room. Instead of being a cost center, it's pitched as a performance driver. It's not disconnected from business goals. It ties directly to hard metrics like retention. And maybe, most importantly, it's designed to reach all employees, especially those frontline teams that often get forgotten.
So what in the world is this high-performance self-care engine? Well, according to the source, it's a system that's built to directly attack business problems like turnover and low productivity. The whole idea is to build up employee resilience, maybe even use new tools like AI to make work easier, and then measure everything to see how it impacts the bottom line. And the rollout is very structured, very corporate. Step 1 is discovery, where they figure out what's going on. Step 2 is custom design, building a plan that lines up with what the business wants to achieve. And step 3 is implement and measure. You roll it out, get people involved, and then track all the data to see if it's working.
So, this brings us right to the core tension of this whole topic. On one hand, we've seen this really human crisis, a crisis of burnout and stress and feeling invisible. And on the other hand, we've just looked at a solution that's framed as a high-performance engine. How do those two things even fit together?
And that leaves us with this huge fundamental question. Can a performance engine, a system built around metrics and productivity, really solve a crisis that's rooted in things like low pay, emotional burnout, and just a massive lack of systemic support? Can a business solution really fix a problem of the human heart? There's definitely no easy answer here, but it's the critical question we have to keep asking as we think about the future of care.